Pamela Supranat, Amy Malo, and Dave Elliott.
That'd be
And-
Kenny Malo under Amy's account.
Okay, and Liz Dupree is getting admitted now.
Copy of the agenda. All right. Oh, I lost my paper that I was. Oh my goodness. My notes right here.
Okay, Pam, about 10 seconds.
Okay, thank you.
Let me know when you're ready.
All set.
Okay, very good.
Amen.
Hi, my name is Bill. I'm the chair for the Sutton Board of Health. And we're going to have to go over a couple things. This meeting will be recorded, I believe, the Zoom meeting, but there's a few things that we have to go over. The open meeting is being conducted remotely, consistent with Baker's executive order in March of 2020. In order to mitigate the transmission, well, we all know that, why we're having it. So for this meeting is being convened by Zoom conference as posted in the town's website. The meeting materials, we all have the materials on our own, nothing is being given out. Non-virus supported meetings, all meeting materials have been provided to the members available to the town's website unless otherwise noted. There are the ground rules. We are now turning to the first item of the agenda. Before we do, permit me to cover some ground rules. I'll introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name, comments, questions, or motions. Please hold until the name is being called, and remember to mute your phone or computer when not speaking. And remember to speak clearly in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage with other members, please do so through the chair, taking care to identify yourself. For items with public comment, all members have spoken. The chair will afford public comment as follows. The chair will first ask members of the public who wish to speak to identify their names and addresses only. Once the chair has listed all the public commentators, I'll call each by name and afford them 3 minutes for comments. And finally, each vote taken in this meeting will be conducted by a roll call vote. Anybody any questions on that? Okay. So the first item, local upgrades variances, 88 Singletary Avenue. Liz Dupree for Clearwater Environment.
I'm Liz Dupree. Do you want me to present it?
Let me see if I can find you, Liz. Okay. Yep.
So we have a septic repair going on at 88 Singletary, and it's a 2-bedroom house. We need a local upgrade on this. reduction to groundwater and some property line setbacks. Specifically, a septic tank that's 4 feet to the property line and 7 feet to the foundation. And then again, with the 1 foot reduction to groundwater. It's a really, really small lot. They're drilling a new well so that they can be 100 feet away from the well. And there's a steep slope out front. So if we don't take the reduction, they're going to end up with a really giant wall out front. So you all have something to look at, or should I show you something?
I don't have anything specific. Do we have anything at the office?
I
Okay,
emailed.
so Yeah, Judy
Show
emailed
you.
it out.
Judy did email everything out.
What's that?
Okay, Steve, did you,
I
did you
did.
have you been there yet?
I have.
And-
I've reviewed the plan. I think that's a good design. There's not a lot you can do. The tank is kind of set where it has to go. There's a
Right.
retaining wall in front of the house that kind of forces the tank into that location. And as far as the reduction to the for the groundwater separation, I think that's needed for aesthetics as well. That would be a costly wall to build without trying to lower that system. So
Right.
the design, I think, is a good design for that property.
Okay. All right, do we have to make any decision on this, or are you gonna continue with that, Steve?
I'm all set with that design. It's all they're asking for from the board is the separation from the tank to the property line. That one.
I'll make a
Um,
motion for that.
Kenny, what was that?
I'll make a motion to approve that.
Okay, someone want a second?
Do they have to do a deed restriction because it's a 2-bedroom or not?
We have
Yeah.
a deed restriction on the plan, yeah.
Yeah, there is.
Bedroom.
Is a deed restriction on the plan?
Yes.
There is.
Okay.
I have a question.
Yes.
Okay.
I didn't know, are there any abutters that want to make a comment?
I don't think we have any response there. Does anybody want to second that motion that Kenny put forth?
Should we check if that's John on the phone? So there-
Is that him right there?
Or the other abutter. Yes.
I'm in abutter, Terry Wendell, 94 Singletary Ave.
Okay, Terry, and you have remarks?
Is this going in the front of the house or in the back of the house?
In the front.
Well, it seems like a big lawn, a big area in the back. Why can't it go in the back of the house?
The well is in the back of the house.
Oh, well.
The septic right now goes out to the front.
Okay, and okay, it goes up there. It's going to be within 4 feet of the tank's going to be within 4 feet of my stone wall, correct?
Yes.
And where's the leach field going?
The leach field is going to, it has the appropriate offset from the stone wall.
And how far is that from the stone wall?
It's just over 10 feet. And that's in compliance with Title V.
So the only thing that isn't in compliance is the cement tank itself.
Yep,
And the leach field is in compliance, correct?
correct.
Okay, thank you.
Thank you.
Thanks. Anybody else? So we have one person that voted to approve. Make a motion to approve. Do we have a second?
Well, we're going for the 4 foot from the property line, the 7 foot from the foundation,
That's
and
correct.
3 foot offset to groundwater.
Yes.
Those are the 3. Okay, I second it.
Thank you. So
Is that the Board of Health?
I'll approve, all 4. Is there anyone against? Okay, then we'll, that's so moved then. Thank you. Thanks, Liz.
Thanks, Liz.
Okay, thank you.
Done.
Should I stay, Steve, for the item 4?
Good luck, Liz. I can handle that. That's 15 Glen.
Yeah, okay.
It's just
All right.
that there's no, they're kind of straightforward. No butter notification for that one.
Okay. All right, thanks, everyone.
Thank you.
Yeah, Liz.
Thanks, Liz.
So is that what you just spoke on, Kenny? Steve, was this one just now?
Yes, the next one
reader
on the
upgrade?
agenda, 15 Glen.
Okay,
That's also a repair, a septic system repair, for existing 3-bedroom house. The local upgrade that's being requested is a 3-foot separation to groundwater from the proposed leach system. For cost and aesthetics for the property, I recommend that is approved, and I'm okay with that. And that's the only local upgrade that's being requested. There's no property line or anything that required a butter notification.
okay. That it?
Yes.
All right, department update?
Can we slide by a department update and the COVID-19 update and move down the line a little bit for a few other things? Then we can come
What do
back
you
to that later.
Okay, where do you want to go?
Other business not anticipated.
Okay,
Would you mind? Would that be okay with you, Chair?
yeah, that's fine.
Okay.
And what other business not anticipated are we bringing up?
Okay, we had an inspection at Camp Blanchard, and we have, I believe, on the line with us, the inspector that had done the inspection, the camp inspection, Jim Philbrook. And I do believe we do have some members of the YMCA also online. And I'm just going to invite, have Jim just review the report, and anybody can ask questions, or if anybody has any comments they'd like to make, there can be discussion brought forth.
Yeah, can I just interject for a second that John Silverberg is still trying to get in, but he's run into an issue while he's on the road. He's out in Springfield, so just be prepared if he's trying to call in when he does get a chance to make sure he gets in.
Mm-hmm.
He's got a leak in his tire, so. Okay, who wants to go first?
I can, maybe Jim Philbrook can introduce himself, and as he was the inspector, he can identify himself and just tell people about a little bit about his background, and can review the camp report.
Okay, Jim, thanks for coming.
All right. Hi, everyone. Through you, Mr. Chairman. My name is Jim Philbrook. I'm the health director for the town of Charlton. I was asked by Cheryl Lewinsky during difficult times of helping out the town of Charlton as a public health nurse during the COVID-19 pandemic to do an inspection of Camp Blanchard. I've been doing camp inspections for over 20 years. There were some issues at the camp, and I know that caused them to decide not to open. I'm not sure where they're at with the corrections of the violations, but it does cause me to, as a licensed lead inspector for the state, determine that I didn't do the inspection, and I didn't think there was a need to do a lead inspection, but I determined that during my inspection there was some lead in one of the buildings, but I do need to do an inspection to further do a determination. Also, there was some other issues with that were violations. I'm not sure if everyone has the report. It's quite lengthy. I don't think you want me to go through it, but there are quite a few issues to be addressed. Some of it's the poison ivy. Some of it's the maintenance of the camp areas. Some of it is due to a lot of trees and debris that would cause infestation of mosquitoes, and that needs to be corrected along with the poison ivy that's throughout the place. There was some issues involved with 105 CMR 432, which is the beach regulations, with some posting, very minor stuff as far as that is concerned. The staff was very cordial and very very knowledgeable in what the camp would be, but these violations are based on the minimum standards for camp regulations that need to be corrected. So I'm not sure where the YMCA is at or where the board feels that where they want to take this, but there's certainly addressable issues. And I think that I just don't know at what point that the camp, I do inspect Camp Foskett in Charlton also. So I know that the YMCA's are really the only camps that are open during this. Very difficult to comply during this COVID-19 pandemic with masks and everything. But the issues that were the violation were not related to COVID. They're related to 105 CMR 430, which is the camp regulations. So I did note those and did send over forward the report to Cheryl. And I believe that I just need to know if, you know, as the board and Mr. Chairman, through you, if they're going to make the corrections and ask for a reinspection of the violations as noted in the report.
At this point, I'd like to hear from the YMCA. I do have the report, and it's lengthy. There's a lot there, as you say. Some seem to be things that probably, you know, I would have had done just to make it look good, but weren't done. And then there are the more serious ones. So I assume that the gentleman from the YMCA does have the report and has spoken to the staff over there. So if he wants to chime in at this point, then we're more than welcome.
Yes, good evening. My name is David Connell. I'm the president and CEO of the YMCA, and have been at the YMCA for a good evening to all of you. And thank you, Jim, for doing your work also in the Camp Foskett for us, and likewise Cheryl in the work that's been done before. I'll start from this particular perspective, and Jim said that we opted to close the camp this year. That is not that's not accurate. We certainly understand what we saw within or heard verbally on the report. We received the report yesterday. We've had beginning the first stages of going through read the report. But let me place some things into perspective of where we are, similar to everyone else in regards to 19. And I also work on the governor's plan for reentry. And we do serve a number of locations in Central Mass, including Camp Loeb in Lancaster, Camp Foskett. We also have DPH licenses in Worcester. From my perspective, some of the things that I see on the report, and again, I do have two of my experts, being Dave Elliott, who works with the property in camp, and Pam Supernaut, who runs the programming for all of our youth development locations. From my perspective, some of those things have been there over time, and we did have a inspector review the property. So when I started to see some of what was taking place, it draws some concerns, because we chose to try to open up all of our camps, because in particularly Camp Low and Camp Blanchard serve, and including Camp Foskett, serve low to moderate urban market children who have been locked up for the last 100 days in spaces where there are 3 rooms. And we may be the only place within Central Mass that has green spaces. And we opted, even with the COVID regulations, to having a higher volume in terms of physical distancing, triple our costs. And we elected that we would cut our staffs, but yet bring in camp people to make sure that the urban market individuals, Black and brown children, will have the opportunity to come to green space. So it's very, very upsetting for us at this point that we may not be able to deliver that. We certainly, from the physical distancing and the rules and regulations, we automatically, in this camp, had the regulations that we could not even bus kids, even with utilizing transportation with 12 kids on a bus. So that was already taken off the plate. Now we have, in this situation, now that we needed to go back to families and say, you have no places to go this summer. They're back inside a room in a time where we could be, the other states are having hotspots. So I want to just make sure that we are aware of the impact of this, and I'm probably not necessarily intentional, not saying that, but the impact of this is that we're now impacting 100 plus children, some of them from Sutton and Northbridge, and I live in the town of Northbridge, but primarily from the city of Worcester and primarily the city of Worcester, urban kids who spend their time on camp. So here, the pathway that I see is that I saw some things that seem that they're long-term issues that in the length of time that we have to run camp, that they will not be able to be corrected, nor were they cited before. And I understand if it's cited now, we will move forward to try to take care of those. I also see some things that seems like immediate fixes, and we believe we can take care of those. But what we do not have is the time to do some of these things in rapid days. That the information came to us last Thursday. Our expectations that we were going to be open yesterday. So we've already lost a week. We already scrambling. We try to take care of those families, but there are other families that after 4th of July will need to be out there. So from an overall perspective, it is impacting lives. We were one of the few places that we expected to be open in order to serve the communities we're serving. And I'm hoping that the resolution here this evening would be that we find a way to get us at some point within this summer that we can open camp. That whether it's the review of that report and identify the things that are immediate fixes that we believe that we can settle with in this particular phase. And then if there are long-term fixes that we do that. All of it costs money in a very difficult time. And we understand that. We're working hard to raise money to do so. But that's where we are at this point. I do have Camp Foskett that is open. But in some cases, we certainly want to make sure that we can continue to serve populations in Southbridge, populations in Fitchburg, Leominster, and populations right in the city of Worcester and beyond.
Thanks, David. Just a point of reference, I'm president of the board for a nonprofit in Worcester, Net of Compassion, that works in that area of Main Street, and I'm familiar with the people and very sympathetic about having these kids having a place to go. I hope you respect the idea that it's our job to make sure that they're all safe, and I think that's the ground, the base point from where we're going to be coming from. And quite frankly, when you look at the report, I have a question as to the safety of the kids. I'd love to see them get out of the city. I'd love to see them get to camp. I'm sure it makes the summer, but with our knowledge of unsafe and hazardous, whether it be buildings or other hazards, having that information and then having something happen to the kids would be a double hit. We'd love to see the kids there, but certainly we don't want the kids to get there and end up in any sort of health issue. But I know that you brought Dave. Dave, you want to speak to this as well? You got to unmute Dave. Dave Elliott, there you go.
My only comment is I walked with John Cottrell the day before, and he had no issues with any of the buildings. I have done everything he's asked us to do. Last year, we invested over $10,000 in materials, which I personally did the work to remove rotted subflooring, piers, whatever the buildings needed to be proper. As far as repair of the roofs, they're not leaking. They have some moss on them. They have some sticks on them. I'm just going with John. I've done everything John's asked me to do, and I was quite surprised with some of the comments in the report. John told me where to put gutters. I put them there. Now this report states that we need to have gutters on all the buildings and all the places. I'm a little lost as to where the line is drawn between Board of Health and the building inspector, but we have done everything that John has asked us to do. Cheryl in the past has checked the buildings for cleanliness and things of that nature. We really never got into any kind of codes as far as roofs or things of that nature. And, that's where I stand as the Director of Property for the Y of Central Mass. Yes, we want to be safe, and we will be safe, but everything on the report is new and a surprise from previous inspections.
And we do have Pam Supernaut, who's on the call with us, and thank you, Dave. One of the pieces we talk about safety, just so that you are aware, the YMCA of Central Mass had 4 emergency childcare provide locations in the Commonwealth. We actually will probably run the most number of kids within Worcester County and beyond. We did that safely. We closed our last one today. And so from an area around safety and health, we had triple our locations in terms of people and really finding ways to make sure they're safe. But Pam has been running the operations side, and it sounds that the guidance here is really around the building. But Pam, if you can speak to some of it from the operational perspective, please.
Sure. Thank you, Pam Supernaut from the YMCA. Sorry, my light is in a weird spot. So, Jim, from what I just heard you report from the report is, for me, the big sticking points are the lead inspection and an interesting negative pressure cabin. So for us, I did request a lead inspection this week. You're off this week. You said you'd accommodate us next week. So we look forward to a lead inspection. Correct me if I'm wrong, this is not my area, but if there is lead found in that building, we could, one, just not use that building, or two, it's children under the age of 6. So we could literally not have children under the age of 6 on the property if we don't mitigate the lead paint this summer so we can open. And in terms of a negative pressure cabin, we had to Google it, quite frankly, a make your own negative pressure cabin. I looked up the regs, it's for residential camps only. We're a day recreational camp. So I don't know, especially after doing 15 weeks of emergency childcare with nurses and dealing with COVID and COVID symptoms and screening, why we'd need a negative pressure room at Camp Blanchard. So those are my larger
Could you
questions.
answer that, Jim?
Sure, through you, Mr. Chairman. The inspection is conducted not who it is, it's what it is. These are violations that are directly quoted from the camp regulations. A negative pressure room is required when someone is sick and may be contagious. It doesn't matter if you're day or residential, this is required. This negative pressure room has been mandated for many years and you still don't have it. So this is not something new in the regulations, it's something you should already have had. As far as knowing that you want the camp to be open, I believe that based on these violations that I noted, and they are violations, that they need to be corrected before you could place children in danger at a camp just to get them in green space. You want to get them in a safe space. And these are violations that should be corrected before anyone is allowed at the camp. I walked through the camp manager and the camp director was very knowledgeable, very intelligent people, and they realized that these are very old buildings and in some cases in disrepair. Also, the outside of the building, which is generally just a maintenance issue, constitutes the harborage of mosquitoes. We have EEE issues, and certainly there's just a basis of just cleaning this place up. And as far as the lead is concerned, if there's lead paint in there, and there have been children of 6, there's also a mandatory reporter, and the inspection is quite complex. And as far as just closing the building, you still need to maintain 30 square feet for each camper in the event that you have to be inside. So there needs to be a calculation on the number of campers. This was not, just for proper disclosure, my daughter is an employee of the YMCA. So this is not who it is, it's what it is. The camp has violations that need to be corrected and should be corrected for the safety of the children. When children are dropped off there, they should know that they're in a safe place, and it's the responsibility of the board, which was stated clearly by the chairman, that these issues should not be existing during camp. So whether it's the choice of the Sutton Board of Health to make sure that the minimum standards, these are the minimum. This is nothing new. These regulations have not changed. So I did a fair and complex, inspection. I'm very knowledgeable in this area, and they do constitute the harborage of mold. They constitute the harborage. You talk just sticks and stuff. There's 1 inch of mold on top of these roofs. They're widowmakers. There's dead trees that overhang that may cause issues during a windstorm or heavy rain. There's improperly placed propane tanks that could cause a danger. There are a myriad of issues, and these are just issues that, based upon my inspection, that need to be corrected. And it's up to the Sutton Board of Health to make a decision on which way they're going to go and how they would like you to comply. I would hope that the board would stand by my inspection and that you would have to comply fully with the violations before any children would be allowed in Camp Blanchard. Thank you.
Anybody else?
I will just respond to that particular area, and thank you again, Jim, for sharing. And certainly you are the expert in this particular area. We adopted in the beginning that we were not going to come to this meeting because we felt that we wanted to spend some time dissecting the report. We decided tonight, because we were invited to come to share our perspective. We will certainly go and raise money to do what we have to do in terms of serving the many kids that we serve throughout the Commonwealth. I know this is a recorded message, so I just want to make sure that we are clear. The YMCA of Central Massachusetts will never put children in an unsafe environment. The YMCA of Central Massachusetts will never put children and families in an unhealthy situation. We have a principle of 157 years of doing this type of work. So I want to make sure that even in the comments that were made, that we are clear upon that. What I want to just share with you again is that the impact, and COVID-19 is certainly the culprit of this, is that we would have known about this, a different perspective, earlier if we weren't in the midst of a pandemic. So we understand that. We certainly understand the circumstances right now, that we will not be able to do anything until someone can make a visit or we make the changes and those pieces take place. We will see what we need to do, but my team and I need to spend some time reviewing that, because we certainly have 6 other locations that we're running that we will need to take care of those families. So that I just want to make sure that goes on the record. We certainly love the fact of being in Sutton and servicing not only the Worcester residents, but serving the residents that surround Sutton and Grafton and likewise in Northbridge, where I live. So that's where we are. We'll continue to do our work, and we will get back to you and follow up and around whatever the protocol will be, and we'll follow through in those particular areas.
Thank you, David. We certainly respect YMCA and its long legacy of taking care of kids and families. I don't think any one of us has not been touched by the YMCA at some point in our lives. So we do respect what you do. I would ask, is there anyone else on the board that would like to make a statement?
No.
Hi, Cheryl.
Anybody?
This is Cheryl. Yeah, I was just wondering, would it be possible if we had went down and had a meeting on site, and to go down and look at things and evaluate things and just get a bird's eye view right from the ground source itself, and see how this inspection report played into the environment of it and everything else, so we can get a clear picture? Would that be helpful to individuals?
For me personally, I think the picture is pretty clear in that Jim has been doing this for a long time, and none of us, I mean, who has an axe to grind against the Y? Nobody.
No, but I was just wondering, I mean, would it be easier if we went down and we could maybe talk and walk and find a resolution or a solution? Would that be helpful?
I don't know. I would defer.
If I may, I think that Jim's report was thorough. I don't know that anyone else looking at the roof to see the moss or the sticks or where the gas tank is. We definitely have to have the lead paint inspection, and we need to do whatever we can to mitigate either the poison ivy or the roofs and any other things on his list. We definitely will invite you back to re-inspect. So when I was speaking and then Jim spoke, it wasn't that we're hoping to open camp without the re-inspection. Of course, we're going to need to invite you all back to look and see what we've done and if we pass inspection. We just needed the report, and now we have it, and we'll be able to act on it, is our hope.
All right, that's legit. I don't really see any other need to discuss it. I mean, does anyone have any more comments? You know, if they've got the report, you know, as Mr. Connell said, that they would be dissecting it and seeing what kind of action can be taken. And then, as Pam said, that would be invited back for another inspection. Jim, are you going to be able to do that? I know that everybody's kind of stretched pretty thin.
I certainly don't want to hold them back. If they feel that they're ready for a reinspection, I certainly would make time to make sure I get out there, you know, with the request of the board to do a reinspection so the Y could move forward. We certainly don't want to cause any hardship to them, but certainly if they do a correction of an item, I don't want to make them wait. If they feel they're ready to open, I would certainly come out as soon as possible to get them going.
Jim, is there such a thing in this report of getting to a place of the thing that's troubling to me is the camp constitutes a hazard to the campus due to the unsafe buildings. That to me seems a little bit larger than cleaning the roof or getting rid of the poison ivy. Is there a such a thing as the top like 5 things that would need to be done in order for the kids to get out there, or is this the type of thing where we really have to tackle all of it? And I don't know. I'm just just asking.
Yes, Mr. Chairman, if I may, I think remember these are the minimum standards for occupation, so they're not above and beyond. I don't know if the Sutton Board of Health has regulations that would make it more strict for camps. But certainly these are the minimum standards to occupy children's camps. And we try and, you know, make sure that when the children go, as Mr. Connell stated and Pam, they do a wonderful job. The YMCA is as close to my family as can be. We're members in the town of Southbridge also of the YMCA, but it's certainly, if you're going to, I think that the mitigation of the poison ivy and some tree cutting, I know there was a person that cut all the trees for Camp Foskett for free. I would certainly give him Pam's number and maybe he could call and you could actually get someone down there in a few hours and make some things safe. But as far as the cleanup around the buildings, I think that's a matter of just getting a cleanup crew. As far as the poison ivy that's rampant through the place, I think you may have to hire someone to mitigate that. But that's something that's high on the list. The state is very, very strict with mitigation of poison ivy. So the children aren't around it. The negative pressure room is a matter of installing a negative pressure fan and isolation room in case someone does come down with COVID symptoms or is sick. You can isolate them so there's not a spread to the rest of the children, and that's the issue. But as far as the lead paint inspection, I haven't done the determination yet. I'm about 90% sure it is. You would have to close that building, but Pam said it is under the age of 6 that someone would not be able to enter that building. But you cannot have chip paint in a room that would house children in the first place. So you'd have to somehow mitigate that situation. But you could close that building portion of it.
And that's the dining hall too, isn't it?
Yes.
That's pretty significant. Okay.
So once again, I do stand by my inspection. It's based on the minimum standards, and I've passed it over to the Sutton Board of Health and to Cheryl. But certainly, I'm hoping that you can comply and get it safe and get the children there, because I know it's very important to get people out into camp and being social and out of their homes, and it is very important. I understand that, but it has to be safe at the same time. So.
Okay. Thank you, Tim.
Can I just ask one question?
Of who do you want to ask it of, Dave?
Well, of anybody, Jim, I guess in particular, but where do we stand that the building inspector comes in and says the buildings are safe and then you say they are not? Where do I go with that? I'm confused.
With no offense to the building inspector, but as the housing inspector, based on the minimum standards of fitness for human habitation, the health department trumps the building inspector in this case.
So why do I have the building inspector come?
Because he has to sign off on the buildings that they're structurally sound. Mine is more for human habitation and occupation. His are a different aspect of all that. As he said, there are mold on. He wouldn't be concerned with the mold because they're not leaking yet. I'm concerned as the health agent because the mold would affect the children. So there are different aspects but certainly in all aspects, a building can be pre-existing non-conforming, but when an inspection is done for housing by the local board of health, you need 2 means of egress. And at that point, you'll have to install a separate egress at that time. So that's where the health department trumps the building inspector at this case, always.
Thank you, Jim.
Thank you. Thank you all. Appreciate it.
Okay, thank you.
Thank you.
Anybody else from the group? Okay, we'll move on to the next item then.
Chairman, if you may, if you're all set with me, I would like to, this is my 4th Zoom call of the day. If you don't have any further questions, I would like to have dinner with my family.
I'm only on 3, Jim, so you beat me. Yes, go. Thank you very much for the report, and thank you for the testifying. Appreciate it.
Thank you all.
Jim.
Talk soon.
Be safe.
Thanks, Jim.
Thank you all for your help. Thank you. Appreciate it. Thank you.
Thank you, Mr. Connell.
Thank you.
Bye-bye.
Okay. All right. So the next, are we going to go back then, Cheryl, to department update?
Yeah, we can. I just wanted to let the other guests say what they had to say first. Department update. Judy and I have been extremely busy. Today is the end of the fiscal year for us, so we're trying to tie up all loose ends for fiscal 20 and get ready for fiscal 21 that starts tomorrow. As you know, we've been an essential service during this whole COVID pandemic. So we've been operational while the town hall's been closed and not really functioning, and people haven't been in the buildings. But with building and construction being an essential service, we've had a lot of work regarding septic, water, just issues about plans and things like that. So Judy's been extremely busy, not to mention the fact that she's also been helping me with the COVID cases and the billing and reporting and everything else. So we've been very hectic, to say the least. Also, it's also renewal for permits. So we've got, food establishments renewing, as well as rubbish. Basically, I'll just tie this in real quickly in regard to COVID, with all the different changes that are taking place with the food establishments. I've been also reviewing plans because now there's outside seating available. So between John Kuchar and myself, we've been reviewing plans for outside restaurants to be going outside for a while to do their serving of food. And so that's also been on our plate. Getting back to other things that we've done, the building department and myself, we've had the Attorney General come out to the town, the housing initiative, and we've identified 3 sites that we're looking at to have action taken by the Attorney General for the abandoned housing initiative. And I think I spoke about it last time, that the beehive across the street from the town hall is down and has been resolved. And it's all cleaned up, and it really looks quite impressive. Other than that, I'm just going to slide right into COVID because that's
Cheryl,
been, I'm sorry.
Before you go further on that, have we heard back anything from that property on the lake that we were going over? Was it 23 and a half? West Main? Where they had with the outhouse and the septic repair.
It's 21 and a half West Main. No, we haven't.
Okay.
I do believe, I know don't quote me, but I think there was something going on with zoning. So it's over in another department right now, I think, but we've heard nothing since then.
Okay.
And I don't know if John has heard from anybody or anybody else on the board has heard, but we have not in our department have heard of anything.
Okay, thanks.
Mm-hmm.
All right, COVID.
COVID, oh my goodness, COVID, yeah. COVID's COVID. Someone told me today, I haven't been on the news today, but with all our webinars, conference calls and trainings, which take about 15 hours of our week, someone told me today, and I don't know how true it is, that there were no deaths, no COVID deaths today. So I think that's a huge.
That's what the governor said.
Yeah, that's phenomenal. I will say that we have seen a reduction in cases over the past couple of weeks. Last week was very significant. It was very refreshing to see that maybe a case a day in all the towns that we're covering. And we're able to kind of play catch up a little bit, run reports and things like that. So I came into the office this weekend just trying to catch up on some work to get ready to close out our year. And between Friday night, Saturday, and early Sunday morning into noontime, I had 35 new cases. So much for our little lull, but we shall see. And it's been pretty consistent for the past 4 days now that we've gone up a little bit, a little spike in the numbers, but nowhere near what it was during March and April. So hopefully it's on the downhill slide. But what I'm seeing as far as the cases is that they're 20-year-olds. So that's a huge thing. I know with a lot of the social gatherings and the social distancing not being pretty much encompassed, and a lot of the marches and the protests, things like that. So that seems to be, a little uptick there. But other than that, one thing that we have pointed out that we have been seeing is that we're coming across some families, groups of families that seem to be connected, and we're connecting the dots now because we're doing our own contact tracing and not using the states, is that we're finding that the spread is pretty significant in the least amount of places where you would think it would be. So we're really trying to focus on spread right now, but that's about it. Trying to keep our head above water and move on.
If there's a silver lining in the uptick of the 20-year-old cases, the sickness is less severe and certainly not
Right.
killing kids.
Right.
So,
Yeah. So that's it. But I know, I think the last time I spoke to you at the last meeting, it was like they were under 40, but now they're 20 something. So, but whatever. Hopefully, it'll resolve. But where a lot of us are planning to, and it's been talked about, we're kind of planning for a second wave, and so that's it.
Plan for the worst, hope for the best.
That's it. You got it. So that's
Okay.
all I really have to say. Does anybody have any questions or any comments or anything I can answer for them?
Make it okay, John? You're on mute. You're on mute, buddy. I can't.
There we go. Yeah, I made it. Yeah. What a pain in the ass. Sorry, I'm late. I was driving back from New York State and I had a tire warning pressure thing on well, if I drove my piece of junk breaker, I would have been fine. I took my better car and it broke. So I had to stop at every gas station on Route 20 between freaking Springfield and here.
Oh boy.
Anyway, so sorry I'm late. I would have been on time otherwise.
No problem. I'm a week late, so.
Yeah.
Good. Well, that was
like
big.
Did I say that out loud?
Yeah,
you did. That's good.
Okay.
Anyway,
Thanks.
I apologize.
Old or new business?
I don't know business. I'm looking at Judy over here. That's why we both have masks on. We're sitting side by side, so that's why we're masked. No, we good?
We're good.
We're good with old and new business right now.
Okay, I'm assuming that we're not going to see minutes for a while. You're going to have like a minute marathon. We're going to have a minute marathon when this is over.
I Said assumption correct.
Yeah, we'll have to plan a minutes marathon after
Yeah.
this is over.
Yeah.
Because we do have to have them, unfortunately, but, okay. Okay.
Yeah, we're in a pandemic right now, so we're doing
Yeah,
the
I
best
saw-
we can.
I tried to tell my wife that I couldn't pick up the clothes either because we're in a pandemic, but that didn't work. Okay, so we have the usual fee schedule, well regulations, and Title V supplement. What are we doing with that? Are we rescheduling still?
I mean, if Steve had time, I don't know, that was typically something that, at least the Title V stuff was, the changes you wanted to make with that, was something that Jim was going to review. So I don't know if Steve, if that falls under your purview to look at our supplemental regulations and see if they're in line. I don't know what the rest of the board thinks about it. That would get one of those things maybe moving and off the slate at some point,
I'll review that.
Okay. Yeah, our objective was to try to simplify them. I think, is that right, Bill? I think I speak for the board when I say that we were trying to simplify and remove any unnecessary burden.
Mm-hmm.
We were on a nice roll there with on the fee schedules with Kenny getting, I think, what was it, Natick, Kenny, or one of the other towns that we had a bunch of towns. We had a nice spreadsheet going, and in order to do the fees, I'd love to be able to get the fees done so that we can make some, we can have some revenue,
Right.
additional revenue.
Yeah, I agree.
Was it just the fees that we needed to get updated and then have them voted on at a town meeting?
Right. Well, we have to adjust some of the fees just in order to kind of survive, for the way we have it set up right now.
There was a cross section too, Kenny, of different regulations that were either split out into different categories, if I can remember correctly, and a couple of things that we didn't have that we thought we should. Are we allowed to, as a board, have a subcommittee on that, or do we have to do everything in this forum?
I think you have to do it in this forum.
Okay. Because again, we keep pushing. If we can get anything done, if we can get 2 out of 3 done because Steve is doing 5, and we can get the fees done. I think that would be a big plus, especially again when it comes to some revenue.
Did we have? I know Judy and Cheryl are slammed in there, but didn't we have? We had some of the town fees from different towns kind of put together on an email or something, did we not?
Yeah.
I thought we had a spreadsheet put together of all the
We
towns
did.
and what the basic fees were.
Yeah.
I don't know if maybe if you have a quick second, you could send that out again, and maybe if we went through.
I think I actually have it.
Just kind of looked at it. We all looked at it individually and.
Yeah, and I believe it was a document that we could all add or take away from. So let me see if I'll find that, and I'll get it out to everybody tomorrow or maybe tonight.
I mean, it said some additional fees we could add to it, that we don't have fees for right now.
Correct.
Yeah.
Now, with Title V that you see in a lot of towns. As far as review, actually calling anything like that. So Judy can get, and then Judy or Cheryl touches in there, really, they could get a fee for. So there's a lot of fees that we associate with that. Not that I want to kill people with fees, but 80% of the other towns are, so.
I actually have it right in front of me. Title V fee study 2019. So I will send it out tonight. All right. Okay. Well, regulations.
Same. I don't think we've done anything with that.
Okay.
I know that was something that Jim was working on way back when, but Maybe we can just gather, when we're doing fees, just gather some documents from other towns about their well regs and just to kind of match them or see what you want to do with them.
Yeah, if I remember correctly, the wells weren't too out of line. There was a couple tests or something, or stuff that we weren't testing that maybe we should, or test stuff that we were over testing that we could probably eliminate. But I don't think there was something. I don't think that was as crazy as, you know. I think the fees for the Title V are a big one that we should address fairly quickly, just so we can afford to keep everybody working.
Mm-hmm.
Okay. We already did the other business than I anticipated. Next meeting date?
July 28th.
July 28th, Tuesday, last Tuesday in July.
Okay. I'm going right to the calendar now. Whether I look at the calendar is another deal.
Would you say July 9th?
28th.
28th.
July 28th.
Okay. I got it in. At any point in time, you guys want to make a motion to adjourn, we can do that.
Everybody's quiet. I'll make a motion to adjourn.
A second.
Second.
Anybody opposed? So moved. Thank you, everybody.
Bye.
Bye.
John,
Thank you.
John,
Thank
gonna be
you.
around
Have a
for the
good
weekend?
4th.